Wealthy whitecoats don't work harder, they work smarter. Pharmacists are bowing out of traditional roles in record numbers because they know that they're meant for more, and they're really tired of traditional working conditions that just are not serving them anymore and are really burning them out. Chances are, if you're listening to this podcast, you're looking for a way to work smarter too. In today's episode, it's kind of a special episode, and it's highlighting future and current opportunities in precision medicine right now that are uniquely offered to pharmacists and patients alike. And if you know me at all, you know this is kind of my jam, and precision medicine and pharmacogenomics has been my niche in pharmacy for the past couple of years. And so if you'll allow me to indulge a little bit into pharmacogenomics, precision medicine, what they are, how they can serve pharmacists, and why it's such an exciting niche that our profession and you personally, I believe, need to own for better patient care and really unlocking some cool opportunities for your future today. So in the next couple of episodes, I'll be bringing in guests, so we'll have more dynamic conversations talking about how other wealthy whitecoats have done interesting things in their careers and brought a level of wealth to their life. But before we do that, I just feel compelled to tell what I love and is near and dear to my heart, and something that I really believe will bless all pharmacists and heck, all whitecoats who are working with patients today in a number of different areas. So let's just jump right into this episode with some fun statistics about precision medicine. And when I'm saying precision medicine, it's a pretty broad topic, so I'll be pretty much specifically talking about pharmacogenomics specifically. So just to understand today's medication landscape and where we're at today, here's some statistics. 50% of the U.S. population takes at least one medication. 10% of the population take 5 or more prescription medications. There's at least 1 million adverse drug reactions that result in an emergency room visit every year. And adverse drug reactions are the 4th leading cause of death in the United States today, with the cost of adverse drug reactions being $4 billion. Yikes! America has a huge problem with medications. Heck, everyone in the world has a problem getting the right medication for themselves because everyone's different on the inside. And our DNA uniquely influences how medication will likely work, not work, or cause harm for us in our unique bodies. Here's a few more fun statistics. 90% of drugs only work in 30 to 50% of patients. And 95+% of people, really the latest numbers I've seen are closer to 99% of people, have at least one actionable genotype in their DNA that influences medication. So variability in genetic response to medication is common, and almost all of us have it. So here we are. The world has a huge problem with medications, and there's a solution: pharmacogenomics, or PGx. If I say PGx, it's the abbreviation for pharmacogenomics. And especially not just genetic testing and understanding how a patient's DNA affects drug metabolism, but especially PGx when used in tandem as a tool in total comprehensive medication management, or CMM for patients. This is the future of medicine and prescribing and of pharmacy, I believe, is helping patients understand uniquely how medications are likely to work for them and getting them on the right medications, first of all, and eliminating unnecessary medications, duplicate therapy, etc. We could talk for hours about comprehensive medication management with PGx as a tool in there. And that's not the point of this discussion today. I just want to give you an overview of precision medicine and the impact and why pharmacists should be championing it. So for a very simple high-level takeaway, comprehensive medication management treats the whole patient and takes so many different factors in their life into how medications are likely to work or not work for them, including like lifestyle, age, renal function, kidney function, other medications they're taking, their unique DNA, other over-the-counter or herbal supplements they're taking, et cetera, et cetera, et cetera. There's, I think, on one count, at least 23 different points you can consider when optimizing a medication for a patient. So I love comprehensive medication management and could talk at length about it because it's not just genetic testing or just assuming that results from a DNA test will be the only thing that changes prescribing for the rest of a patient's life. While I believe that's true, and I believe every patient who has now or will ever consider medication in their life needs to understand how DNA impacts their medication. That's just a tool in our comprehensive medication management tool belt that pharmacists, as well as the whole healthcare team, can adopt to really better help patients unique to their DNA, their lifestyle, their circumstances, their unique situation. So that's just kind of a definition of what we're talking about with pharmacogenomics and comprehensive medication management. The purpose of this episode today is just to talk about the role of pharmacists in this, because at this point, at 8 episodes in, the statistics show that most of the listeners are pharmacists. So pharmacists, I'm talking to you directly today, as well as anyone else on the healthcare team who's interested. Definitely welcome to join us. But I want to talk about, so if understanding how a person's DNA can change prescribing for the rest of their life, why isn't this standard of care today? And it's for a few clunky reasons, such as it's really hard to integrate with an EHR, traditionally been tricky to get full third-party coverage for these tests, etc., etc. There's many obstacles. But one of the biggest reasons I see is that pharmacists are largely ignoring pharmacogenomics. And we're shooting ourselves in the foot by doing this, and we're very much underserving our patients today by ignoring pharmacogenomics, assuming that someone else is taking care of our patients this way. So I want to just talk this out with you on why pharmacists haven't championed pharmacogenomics in the past. And there's a couple of reasons. I listed them out. There's, 9 different reasons. I'm just going to run through them for you. If pharmacogenomics is the future of pharmacy, and it really creates these knowledge-based roles that we're so excited to adopt to work with for our patients to help us transition out of just product-based roles. Why haven't pharmacists jumped on this and championed it in the past? Because pharmacogenomics has been around for more than 20 years. There's a lot of evidence and clinical utility for it. So why haven't we championed it in the past? There's at least 9 reasons why, and let's go through them. So first of all is kind of silly, but we simply didn't know about it. Now, my experience, I was a retail pharmacist for more than 10 years, and I, as a PharmD, I graduated in 2010. It's not like I graduated 50 years ago. I had no idea what pharmacogenomics was or how it worked. It's kind of embarrassing, huh? It took an adverse drug reaction that almost killed someone in my family before I woke up to the problem or to the solution. I don't know if it was taught in pharmacy school, but I certainly don't remember it. It left no impression on my life that one genetic test can shine a light onto what makes a patient unique and what medications are likely to work for them and what medications are likely to hurt them. And if I, as a PharmD, had no clue about it, I think a lot of our profession do. And now, as I've been teaching a lot of other pharmacists about pharmacogenomics, it seems to be a pretty common theme that if it was at all taught in pharmacy school, it was kind of an aside or thrown in there. Very few programs even have an elective in pharmacogenomics, let alone a lot of heavy curriculum on it. So I think the biggest problem is pharmacists just don't know about it. It wasn't hammered into our heads as being the future of pharmacy in pharmacy school. Therefore, we just don't know the basics, which is so silly since we have this doctorate level degree. But that's reason number 1. Reason number 2 is we didn't feel like it was our place to offer these services. So pharmacists have known about pharmacogenomics. We didn't feel like it was our place to offer this to patients. Our profession is really good at not wanting to step on anyone's toes, and we just assume that prescribers have this covered, and we don't want to make waves by butting in or inserting ourselves into that relationship. Pharmacists are very good at not ruffling feathers and trying to keep prescribers and patients happy. And number 3, it feels like a specialty service, because even if we see the value of pharmacogenomics, it's easy to feel like we aren't enough in our practice to help patients with it intelligently. So we stay quiet and would rather just refer to someone who does it or not say anything because we don't want to do anything wrong. That we assume that like pharmacogenomics has genetics involved in it, so you must be really smart to have to do it. Therefore, some other smarter pharmacist or genetic counselor or doctor can help patients, but you as a PharmD are not enough and you shouldn't step where you're not supposed to go. I think it's kind of felt like that. Like even if you know about it, it feels like a specialty thing and like not something that you should offer to help with. Number 4, we're just not taught PGx in pharmacy school. I know it's kind of simply the same as number 1. The difference between number 1 and number 4 is number 1, like pharmacists just don't know about it in general, and we're not like talking about it in practice. And number 4 is it's not a heavy part of the curriculum in pharmacy school. And so they just don't place a lot of emphasis on the teaching and on the training and part of our curriculum. And number 5, PGx labs have only targeted doctors to implement this technology. We've never been invited to the conversation by testing companies to partner with them to provide this service for patients. Most doctors have probably at some point heard from a genetic testing company to offer this service to their patients. They have not been reaching out to pharmacists and haven't until recently even considered pharmacists as part of the picture. So we as a profession feel like we're not allowed to this party, and like, especially if forward-thinking pharmacists talk to labs and labs just don't know what to do with pharmacists, and like, can pharmacists order the test? I don't know if they're a medication expert or not. Like, it's so silly, but as far as marketing goes and the proactive labs who are out there trying to get patients tested have really only been talking to prescribers rather than the medication experts, pharmacists, to implement this technology, give them resources and examples, and just have basic outreach to them. Number 6 is we're just too busy in dispensing roles to have the bandwidth for PGx. Dispensing pharmacists are busy. Go into any pharmacy in the country and you can see that dispensing pharmacists are very busy. And we simply don't have the time or space for complex, lengthy conversations that are required to talk to patients about their genetics. As much as we want to have these conversations and to have really meaningful patient encounters, unless you have a really forward-thinking pharmacy with a separate counseling area, with the workflow to give the patient and the pharmacist adequate time and to charge for that service, it's just not happening effectively in a regular pharmacy. If you were to say, okay, here's a PGx report, now talk to the patient how it applies to this medication that you're dispensing today, it would be almost impossible with the current workload of a dispensing pharmacist, where many of our profession are spending their time working. And number 7 is insurance didn't cover it, so pharmacists were scared to charge for it and assumed that no one wanted it. Instead of showing patients the value of changing prescribing uniquely for them for the rest of their life, we only focused on that if insurance will cover it for zero copay or not, then I feel like patients would want this. We assume as whitecoats that if it's not free, patients don't want this. And that couldn't be further from the truth. Out there, patients right now are really suffering from not getting the right medication for their body, especially in the mental health area. And when we just hold our light and not even offer it to them because we assume that they don't want it or they can't pay for it, it's doing our patients a disservice by not knowing what options are out there for them. And then a one-time test can empower them and change prescribing to them for the rest of their life. Number 8, okay, remember we're doing 9 steps. We're on 8 of 9. Here we go. Number 8, we were waiting for our employer to bring us the PGx testing framework for our W-2 jobs. So those who have seen the value of PGx have even gotten certified from a fancy program. Most all of them are just patiently waiting on the sideline for someone, usually an employer, to do the right thing and bring this line of service that we can plug into, rather than saying, okay, I'm a PharmD. I know what to do. I'm going to start bringing this line of service to my community now. I'm not going to wait for other people. It's the right thing to do to help people. I'm going to bring it right now instead of just waiting for someone else to take the initiative. And number 9, that leads perfectly into number 9. We were just scared to help patients in a newer and higher way. Change is scary. Pharmacists love to follow rules. We do not like to rock the boat. And we say we want to do new things, but we're so freaked out to actually do it. In fact, we are so freaked out that we're doing something wrong by helping someone that we choose to stay quiet and not help rather than do something right. So that was my list of 9 reasons why pharmacists haven't championed PGx in the past. And so now I want to run through kind of another list. This only has 7 points, and we'll go a little faster, on why, going forward, pharmacists are the ideal champion of precision medicine, especially pharmacogenomics. You ready? Here we go. So pharmacogenomics, we're the medication experts. Number 1, we're the medication experts. We hold a doctorate degree in pharmacokinetics and pharmacodynamics. What other profession could be more suited to understanding how DNA affects drug metabolism? We are enough. Even if we feel wildly insufficient, if not us, then who in the world is going to do this? Number 2, prescribers just don't have the bandwidth to embrace PGx. Prescribers have more than enough on their plate. In fact, they're already bursting at the seams right now. Trust me, a busy doctor getting 100+ page complex PGx report that they are then expected to interpret, mesh with the rest of the patient's unique metrics, and then decipher to the patient in only a few minutes of communication together, that's not going to happen, no matter how important that report is. This is where pharmacists can shine and take a load off busy prescribers and really take on the role of medication experts. Number 3, this is fun, right? Number 3, we're America's most accessible healthcare professionals. 96.5% of America lives within 10 miles of a pharmacy, and 48% lives within 1 mile of a pharmacy. That means pretty much anyone can just walk into a pharmacy and talk to a pharmacist directly. No other healthcare professional can you just walk into and talk to for free. And that's why we're also one of the most trusted healthcare, not even just healthcare, most trusted professionals. If you Google most trusted professionals, pharmacists have been making the top 10 list for as long as I've been in the pharmacy world, which is like 15 years. So we're the most trusted professional, we're accessible, and we actually have a recipe for helping people in a higher way. People already know us, like us, and trust us. Now it's just up to us to offer new services and new ways of helping them. Like, it's not like people don't trust you and don't love you and don't have you accessible. We have all the recipes. It's just us not offering new ways of working together. And number 4 reason on why pharmacists are ideal to champion pharmacogenomics is that we really yearn to help patients in a higher way. We went to pharmacy school to help people, not to medicate people, right? You went to pharmacy school to help people, not so you can medicate people. And I know I felt really frustrated when I saw patients trying medication after medication after medication to solve a mental health problem, and got so frustrated after months or even years of playing the guessing game. We have tools to help our patients uniquely instead of just staying stuck with the transactional phrases that I said way too many times over the years in my patient consultations at a 24-hour pharmacy that was doing more than 1,000 prescriptions a day, like, take this with water, avoid alcohol, and my favorite, here you go, just call me if you have any questions, okay? And then they'd have to be on hold for like 20 minutes, and only the most tenacious would stick with it. We want to help patients in a higher way, so let's help patients in a higher way starting today. Number 5, we understand that genetic testing won't solve everything, but it's a valuable tool in our tool belt. As pharmacists, we have a really healthy fear and respect for medication. We know that even with genetic testing, there's so many different factors that contribute to how a medication works for someone, and we're the experts to bring that all together. I have a list of all of the things that should be covered in a comprehensive medication management evaluation for a patient, and I just keep adding to them because I keep thinking of more. At the last time I looked, it was 23 different points to consider for patients that affect of how they affect medication. And most of these are things that you know. Obviously, number 1 would be like genetic testing and how their genes work, but also drug allergies, drug-drug interaction, drug-drug gene phenoconversion, renal function, kidney function, age, sex, weight, pregnancy status, blah, blah, blah. That's just 10. There's so many things that contribute to a medication and how it works with our patients. And when we have all of these tools to help them, then we can really effectively help patients like no other profession can. Because if you just treat the drug-gene interaction, then that's a big step forward and it's better than nothing, but it's still only a piece of the whole puzzle of the patient. Number 6 is that no other profession has owned pharmacogenomics. Now, right now, if you're a pharmacist, your natural inclination may be to suppose that maybe genetic counselors are more rightly suited for all things genetics. Rightly so. Genetic counselors are amazing. I love genetic counselors. However, pharmacogenomics is kind of its own thing. It doesn't fit in with the rest of genetic counseling. PGx is really so much more about medication pathways than general genetic testing. And nearly every genetic counselor I've spoken to feels intimidated and actually uninterested in mastering pharmacogenomics because you really have to understand complex medications to thrive in that role. And as you know, that's not easy to do. Genetic counselors are a great help, but to really own pharmacogenomics, it's not the right profession for them. It's for pharmacists, not genetic counselors, not prescribers. Pharmacists are key, obviously communicating with the rest of the healthcare team, but it's really us who need to own this space. And let's just say theoretically, even if genetic counselors were better than pharmacists at talking with patients about pharmacogenomics, there are so few out there that it would be months before a patient could even get an appointment with one. There's just such a huge need out there and there's so many pharmacists who are looking for more. Like this is such a great role I want you to know about. And pharmacists, on the other hand, are just hungry for new roles and helping patients in a new, more innovative way. And number 7, point 7 of 7 of why pharmacists are ideal to champion pharmacogenomics. I believe it's our moral duty to get patients the proper medication as quickly as possible. Trial and error prescribing is antiquated and it's dangerous. We must help patients as well as we possibly can. In fact, litigation is happening for pharmacists and prescribers who ignore PGx testing. It's our moral duty for our profession to help our patients as best we possibly can. And I think we're just limiting ourselves by not feeling like we're enough or being scared of it. By being scared of it, patients are suffering, and we're not being responsible pharmacists by ignoring the fact that medication does not work the same for everybody. I could go on and on. Do those 7 points convince you? I hope they do. Here's my takeaway. For those of you who are interested in entrepreneurship and to really champion pharmacogenomics, I can so help you, wealthywhitecoat.com. But I truly understand not everyone wants to hit the ground running with this and to say, okay, Jamie, I see the vision. I'm catching it. I want to go all in on owning pharmacogenomics. I get that. So for all the rest of you, I just want to educate you about the science and my great takeaway points, just so you can help those people in your life and in our profession to spread this message and just basic awareness. So here's a few takeaway points as we close. First of all, every pharmacist who works with patients and medication can benefit from a basic knowledge of PGx. It is not and should not be considered a specialty that only a few can dabble in. This should really be standard of care, that we know this is a tool, and whether we feel confident ourselves or refer to someone else is part of our conversation with patients, especially if they feel that adverse drug reactions are happening or medication is not working. Number 2, takeaway point, very, very few pharmacists are working this way. So if you're a forward thinker who is excited about doing new, cool things in pharmacy, there's a really big opportunity to stand out and help your community you're living in right now in a way nobody else is doing. Point number 3 for our takeaway point is that you can bring PGx to your community as a line of service you offer under a really simple, minimalistic business. And doing so is the easiest way to stand out in your field and make yourself more valuable in your career. Most pharmacists think that the way to stand out within precision medicine is to get a PGx certificate. Then I'll be certified. Then I'll be an expert. And while I love certification programs, I've taken one. I see the value in them. To really stand out would be to take the next step and to create a business, to create a solution to start helping people, because then you are a problem solver rather than a more qualified pharmacist waiting for these services to come to the community so then you can jump on the bandwagon. Pharmacists who solve problems and create solutions for their community rather than waiting for them to come to them and ask for it really stand out, and they are wealthy whitecoats. Takeaway point number 4, tell people about these services, please. Pharmacists just need to know that a simple genetic test, I'm talking 10-second cheek swab or a simple saliva sample, will change prescribing for the rest of the patient's life. Even if you do not feel adequate to do it yourself, make sure your patients know this is an option for them. Preach it from the rooftops and make sure it's part of your conversation with patients, that they know that there are solutions and tools that can help them. Point number 5 is that patients are actually ordering these tests themselves. They're ordering them through online, through 23andMe, through patient self-order tests, but also major labs are also providing an option on their website. I just went to both Invitae and Oneome, two of my favorite labs in the past month, and you can order a test through them. They have a third-party provider who actually orders the test, but patients can have interest in a PGx test, go online and have it ordered in 5 seconds with a click of a button without talking to their provider, without talking to their pharmacist. Patients can get these results, and I think that's so exciting, and it's amazing. And I want patients to get these results who want them as fast as possible. And understanding that patients are ordering these themselves, it really shows that patients are hungry for the knowledge, and when they get the results, they're going to be very complex and overwhelming. So why aren't we helping them with this? Patients want these tests. They're ordering them themselves. Please see that they want healthcare professionals and they need them on the receiving end to understand what the results mean, what are the most important takeaways, and how they apply to their life. Last takeaway point. Here we go. If we ignore this huge area of opportunity, then we're going to give up massive potential for pharmacy to break free from dispensing and to really be worthy of that PharmD degree once and for all. Pharmacists are looking for a bright future, and here it is, all wrapped up with a bow. You know, clinical guidelines, actionable data showing cost savings and cost avoidance. It is here. This concludes my soapbox. I'm very passionate about precision medicine and just shaking whitecoats, especially pharmacists, up to the opportunities out there. Whether you want to jump all in to be a PGx master in your community, or just be aware that it's a resource for your family and friends who are not doing well on their medication, and to be able to bring it up in patient conversations as a resource with patients. This is such an exciting place to be, and as pharmacy is changing, we just have to embrace new and exciting roles like this. So in the show notes, I'll throw the reference that I used for these statistics, as well as a couple of write-up articles if you're interested in this that I've written on the subject. And as always, go to wealthywhitecoat.com if you're interested in a presentation on this, because I love talking about this subject, and regularly I do a presentation teaching pharmacists and showing case studies of pharmacists successfully building their own consulting practice through precision medicine. So thank you for joining me in White Coat Wealth today. In the next couple of weeks, we're going to have some exciting guest interviews, and we're going to talk about a couple of different areas of being wealthy and different niches that white coats are owning. I'm really excited to have more interactive conversations to come. And thank you for listening to my soapbox about precision medicine and the bright future I believe it is for pharmacy.